high tibial osteotomy, platelet-rich trauma, BMAC, knee preservation versus Varus, deformity, or bow legs. Hello, if you have been suffering from inner knee pain and have tried treatments like PRP, RFA, which stands for radiofrequency ablation, hyaluronic acid, or proximal fibular osteotomy with only temporary relief, this message is for you. Recently, I met a patient from Canada who has come to Chennai for a short vacation. He arrived with severe right knee medial compartment arthritis, difficulty in walking, and pain on stairs. Like many patients across the world, he had been repeatedly offered steroid injections and told to continue painkillers, but his pain always returned within 6 months. The underlying problem was not just cartilage wear, it was varus malalignment, that is a bow-leg deformity that constantly overloaded the medial compartment. And here's what every patient needs to understand. If alignment is not corrected, biologic treatment will not last. PRS, stem cells, or even PRP cannot give long-term results if the knee remains mechanically imbalanced. In an ideal situation, the best approach for this patient would have been high tibial osteotomy combined with biologics. But since he is here only for a short vacation, we had to strategize intelligently. So we created a step-by-step joint preservation plan. Firstly, I have done a PRS treatment now to improve the biology within his joint and reduce inflammation. Secondly, he will be fitted shortly with a corrective knee brace designed for varus deformity. This brace will shift body weight away from the damaged inner or medial compartment while he returns to Canada. Third, within the next 6 months, he will return to undergo high tibial osteotomy, the definitive correction that will offload the medial compartment permanently and preserve the knee for many years. This staged plan gives him pain relief now, mechanical correction through bracing immediately, and long-term joint preservation through high tibial osteotomy soon. This scientifically layered approach is what many patients around the world are missing. Let me emphasize the truth. PRP alone will not stop disease progression. Radiofrequency ablation reduces pain but does not slow arthritis. Proximal fibular osteotomy does not correct alignment. Lasting success requires both biologic and biomechanics. By combining PRS now plus varus corrective brace now and HTO or high tibial osteotomy later, we are planning for real, durable knee preservation, not just temporary pain reduction. If you have been living with repeated injections, temporary relief, and worsening bow-leg arthritis, don't give up. What you may really need is alignment correction plus biologic support, not just pain procedures after pain procedures. I am Dr. A.K. Venkatachalam, and my mission is to help patients keep their natural knees functioning for as long as possible with joint preservation surgery and orthobiologic treatments rather than premature knee replacement. Thank you for watching. Stay tuned for more educational videos on PRS, BMAC, knee alignment, and joint preservation. If you found this video helpful, it would be great if you can give it a thumbs up, share it with somebody who is contemplating a knee replacement, and press the bell icon to receive updates whenever I upload a video like this in future. Thanks for watching. Have a nice day.